Welcome to Preventing Falls and Injury from Falls, Risk Factors that can lead to falls and falls with injury, a frontline forces training presented by Superior Health Quality Alliance, or Superior Health. The information contained in this module is relevant for nursing assistants who are on the front lines of providing care for residents, anyone providing care to an older adult in any caregiving capacity, and even those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding of the risk factors that can lead to falls and falls with injury in older adults. Superior Health aims to empower you by increasing your confidence with making the right decisions, knowing when to tell someone what you see, and the ability to prevent falls and falls with injury. The purpose of this course is to further your learning and application of these skills to real-life situations. What you do can improve quality and safety of older adults in your care. This learning module, Preventing Falls and Injury from Falls, is a 3-part series. You are viewing the second of the series, Risk Factors that can lead to falls and falls with injury, which provides an overview of risk factors for a fall and strategies on how to eliminate risk factors for falling. This module has 2 additional sections in the series. The first provides an overview of the significance of falls and falls with injury, and the third provides an overview on understanding your role in preventing falls and injury from falls. It is not necessary to complete the entire series in one sitting. You can leave and return to the course at any time. After completing this module, you will be able to recite the reasons falls are an important safety issue, recognize risk factors for falls, and identify reasons for high-risk falls. Falls and injury from falls can have a significant impact on the quality of life of older adults, physically, emotionally, and financially. It is important to be aware of the possible threats that put people you care for at risk for a fall. Let's take a look at Herman. Herman is an 84-year-old man who has been living in a nursing home with his wife for the last 2 years. Herman has moderate dementia, and his blood pressure falls when he stands up too fast, which makes him feel dizzy. Recently, his wife passed away, and since that time, Herman has been more depressed and has difficulty sleeping. 2 years ago, Herman used a walker to get around, but now he mostly uses a wheelchair. He also is less able to complete toileting, bathing, and grooming on his own. Over the past several months, he has become less aware in his surroundings and has experienced a loss of balance, resulting in many falls, most of them happening over the nighttime hours. Does Herman sound like anyone you care for? As you listened to the story, what were some of his risk factors for falling? His moderate dementia? His low blood pressure and feeling dizzy when he stands up too quickly? His feeling more depressed lately? His difficulty sleeping? His decline in his mobility, including his use of a wheelchair and becoming more dependent with his own toileting and personal care? His impaired awareness? His history of falls? As you listen to this learning module on the risk factors that can lead to falls and falls with injury, keep Herman in mind, as well as the other older adults you provide care for. As his caregiver, how might you help protect him from having an injury from a fall during the night? Who is at risk for falling? Everyone. It is important to be aware that the more threats or risk factors that are present, the higher the risk the person will be at for having a fall. I will review many of the risk factors in alphabetical order now. Age. Older adults have the highest risk of death or serious injury arising from a fall, and the risk increases with age. In the United States of America, 20 to 30% of older people who fall suffer moderate to severe injuries such as bruises, hip fractures, or head trauma. This risk is in part due to the physical, sensory, and cognitive changes associated with aging, in combination with environments that are not designed for an aging population. Awareness of surroundings. Being unfamiliar in one's surroundings or being in a less familiar place can cause confusion, disorientation, agitation, or aggressive behaviors. Being in an unfamiliar environment can cause someone to become nervous, anxious, belligerent, or hostile. Likewise, having confusion, disorientation, agitation, or aggression, or feeling nervous, anxious, belligerent, or hostile can also lead to someone becoming unaware of their surroundings. Diminished strength can also increase one's risk for falling, and loss of strength is oftentimes the result of lack of exercise and limited activity, which then leads to lower body weakness and difficulties with walking and balance. Gender. Both genders are at risk of falls. However, some studies indicate males have a higher risk of falling. Hearing loss. A person may not hear a cart or a wheelchair coming down the hallway and not move out of the way to safety. Noisy environments can also cause agitation. Alarms from unknown sources can result in defensive responses, such as agitated behaviors, calling out, physical aggression, physical attempts to escape the stimulation, or shutting down and withdrawing from the stimulation. This is especially true with people who have dementia or who are cognitively impaired. History of falls. Impaired touch or smell, impaired gait, balance, or mobility, such as a shuffling gait, can also lead to a higher risk of falls. Memory loss or impaired cognition, including changes in mental status, acting impulsive, being disoriented, and being confused, can increase with age. Dementia, Alzheimer's disease, and other cognitive changes or impaired social functioning caused by changes in the brain can affect memory and the ability to think and reason. These are all additional risk factors that can lead to a fall. Pain. Pain or discomfort coming from a physical condition, clothing, or equipment, such as poorly fitting shoes, can cause unease and agitation, adding risk. Vision impairment or loss can lead to not seeing a tripping hazard such as a toy, rugs, equipment, furniture, cords, and more. Supportive equipment and assistive devices. A walker or cane out of reach or improperly used, non-skid socks used inappropriately, and poor fitting shoes are all examples that are intended to be a solution, but can actually be the cause of a fall. You may have noticed I did not provide additional information on medication and medication side effects on the previous slide. That is because here is a slide dedicated specifically to medication and medication side effects. Medications are one of the most important and potentially most modifiable risk factors for falls among older adults. Use of medicines, such as tranquilizers, sedatives, or antidepressants, and even some over-the-counter medications, can affect balance and how steady one is on his or her feet. Polypharmacy, or taking multiple medications, the number of drug medications and potentially inappropriate medications, otherwise known as PIMS, P-I-M-S, can lead to side effects that include a loss of balance, drowsiness, reduced awareness, confusion, or disorientation, putting someone at a higher risk for fall. Additional medication side effects that may also increase one's risk for a fall include medication-induced delirium or other changes in mental status, medication-induced bowel or urinary frequency, medication-induced hypoglycemia or low blood sugar episodes, or medication-induced syncope or fainting can also be associated with certain medications. There are many risk factors that exist in everyday life, from slippery floors to a throw rug to all the risk factors reviewed today. Most falls are caused by a combination of these risk factors. The more risk factors a person has, the greater their chances are of falling. Being aware of risk factors can prevent falls. It takes teamwork, and fall prevention requires you and everyone on your team to be active in recognizing and addressing risk factors that can lead to falls. It is now time to test your knowledge. Click the link for risk factors that can lead to falls and falls with injury quiz on the Frontline Forces webpage or in the YouTube description below.